As we celebrate the Global Med Lab Week 2025 between April 21st and 27th, I would like to present a lab tour of our 24 hours biochemistry lab at Govt Royapettah Hospital, Chennai. On an average, we receive around 100 OP samples and 250 IP samples, including the master health checkup samples. While the IP sample is brought by the multi-purpose worker appointed for this purpose, OP sample is received from the common collection area and brought by the DMLT student, and master health checkup samples by the nurse. After receiving the samples, it is entered into the nominal register, and reports are also issued then and there to the CRRI and special people appointed for receiving the IP reports. Centrifuge is done, and uncapping of tubes after the centrifuge is also done. And our instrument, there are 2 fully automated analyzers, and daily maintenance is done, and QC is checked by the assistant professor. Whoever is posted to the lab on a monthly basis, they come on rotation, and sample entry is done by the in-charge NMA for that duty. Sample uploading will be done meticulously. Analysis and reports are entered. Electrolyte analysis is also done 24 hours. We are doing sodium, potassium and chloride, and critical values will be reported then and there to the concerned wards. And registers are also maintained separately for each of these. This is a TMLT intern who is doing the electrolyte analysis. And night duty samples, we operate the semi-automated analyzer during the night duties, and we cater emergency services. And thyroid samples, we are doing thyroid profile, and both OP and IP samples we are receiving, and we are issuing the report at our lab, while OP sample reports will be issued in the OP collection, common collection area. Indent, mopping, waste disposal. The tube that is used will be recapped, and biomedical waste will be generated. Thyroid assays every week we are doing, or 2 times a week we will be doing, depending upon the number of samples received. We are using ELISA for thyroid assays, and we are having almost all documentation, files, registers, and both of these will be verified by the associate professor as well as the assistant professors. And our lab, we are doing all routine investigations like glucose, urea, creatinine, electrolytes, liver function test panel, serum calcium, phosphorus, uric acid, alkaline phosphatase, serum amylase, urine PCR, 24 hours urine protein, thyroid profile, and everything will be maintained in registers. From 2024, we are started to do the blood alcohol content on trauma patients, and we are maintaining registers for that also. During nights, we receive around 60 to 70 samples, and we do only the emergency test. Critical values are also reported over the phone. Separate registers maintained for each of these. There is 1 associate professor, 1 assistant professor, 3 non-medical assistants, and 5 lab technicians currently working in our department, along with 1 lab attendant. So QC log is maintained by the assistant professor, and calibration values are also entered and checked then and there by lab in charge associate professor. Faculty's attendance will be closed by the associate professor, while the DMLT attendance, students attendance will be closed by the assistant professor. And critical value register will be checked by the assistant professor. Thyroid register will be checked by the assistant professor. CMCHIS incentives will be entered in the system, and proceedings will be maintained in a separate register. So past activities of biochemistry department of Royapettah, we conducted a 1-day CME. It's a felicitation CME for our HOD who retired in 2023, and we also celebrated the Lab Technicians Day in 2024, felicitating one of the lab faculty who was retired in 2023. Our EQUAS is maintained.